This is Steve Heatherly, CEO of Harris Regional Hospital and Swain Community Hospital. Today I'm standing outside of Harris Regional Hospital, and inside the hospital there are dozens, if not hundreds, of patients who are being cared for. Some of those patients have COVID-19, some of them don't. We are experiencing a surge in COVID-19 patients right now. On most days, our ICU is full here at Harris, mostly with COVID-19 patients. And here's what we know about that. Most of those admissions are avoidable. The way they're avoidable is if all those who are eligible get the vaccine.
Hello, I'm Dustin Clark. I'm the clinical pharmacist for infectious diseases at Harris Regional Hospital. The Department of Pharmacy helps treat patients with COVID by acquiring medications, especially some of the new and more experimental treatments. We help track the data and the studies behind those therapies to ensure that what the patients receive is both safe and effective.
I'm Jennifer Grindel. I work in respiratory at Harris Hospital. It's very important to get vaccinated. For one thing, even if the vaccine does not 100% protect you, it will keep you from getting so sick, and you will recover.
Hello, I'm Kate Hernandez, and I'm a float nurse, which means I work all across the hospital. I've been taking care of COVID patients since the very beginning. Why should you get vaccinated? You may think that COVID's not going to affect you or anyone you love, but I promise you I have taken care of someone who looks just like you, or just like your mom or your dad or your sister, brother, even your child. So to make it a safer world, to make it a safer Jackson County, Western North Carolina, we urgently plead you to get your vaccine.
Hi, my name is Susan. I'm the ED manager here at Harris Regional Hospital. I am bedside quite a bit these days and taking care of some of the COVID patients, as we have an overabundance of patients presenting with COVID or with COVID type symptoms. So I work on average 50 to 60 hours per week, managing the department, trying to make sure they have all the supplies they need and supporting the staff in any way I can.
My name is Matthew Burrell. I'm the EMS manager here at Harris EMS. During our daily jobs, we come in contact with COVID patients quite a bit, especially here lately. Our ambulance respond to COVID calls daily. We're currently seeing a higher trend than we did back in January and February of this year of the amount of COVID patients that we come in contact with.
It's important to get vaccinated because the overwhelming majority of the patients we are seeing are unvaccinated.
I'm Tammy Dills, Director of Care Management with Harris and Swain Hospitals. And my role here is to help coordinate and plan the safe discharge of our patients to the next level of care. COVID has definitely made that harder because of limited resources with facilities and external resources, because of their staffing, because their staff have been affected by COVID as well. But everyone is working together in our community to make sure that we help to take care of you. We feel like it's important that you should get the vaccine because it helps to limit the symptoms and things that you may have if you do get COVID. And it helps to keep everyone vaccinated so that we're not spreading this. Let's work together to make sure that we help to control this deadly virus.